Hello and welcome. Today we have a special treat. We are talking with Dr. Navneet Kaur, who is even born in America, is still an IMG International Medical graduate. Before we go any further, I just would like to make sure that if you are on social media, don't forget to follow her on Twitter. That is Navi Kaur MD on Twitter, and she's an avid podcaster. She has not just two Instagram accounts on podcasts. One is I Think Therefore I Am, and another one is Fueled by Medicine. We'll have this information in the end as well. So without any further ado, I would like to invite and welcome Dr. Navneet Kaur. Navneet, very much welcome to our viewers. Thank you so much for being here.
Thank you for having me.
I got a chance to meet you not so long ago at a national conference, and congratulations for your research and posters and abstracts there. So today we would just want to hear from you that what was your journey like from being an IMG from a medical school to your residency, and we might have more questions.
Okay, so I'm part of the very small special group, born and raised here in America. And after high school, I knew that I wanted to pursue medicine as my career. So I actually ended up going into medical school, and I went to Government Medical College of Amritsar in Punjab. So not only did I go to medical school there, but got to learn about my culture, learn about my family. So it was a great experience overall. But of course, at 18, I was thinking about how great this experience was, and I wasn't really thinking about residency and all the hoops that I would have to jump through as an international medical graduate. So the one thing about being a U.S. citizen and going abroad, I didn't have to deal with a lot of the visa issues that many of my colleagues and friends did when they were applying. So I won't have much to say on that aspect, but everything else I can give insight to. So, as I was finishing up medical school and getting ready to come back to the US, I started figuring out things that needed to be done. So when you come back, or even as an IMG and you're coming to the States, you want to have letters of recommendations from US physicians. So it's very important to actually work with these physicians and do rotations. So it's important and you can do this online through Google, or, maybe your seniors have done rotations. I can give you the names of the places I did my rotations. I'm from Oregon, and Portland, Oregon. So I did my rotations in the Pacific Northwest, but a lot of my friends did them in New York, in Florida. Actually, one of my juniors from my medical school is actually at FIU in Miami right now doing an away rotation. So it's important about getting rotations, I would say. And it would be ideal if it was in the field that you're interested in. Because, if you're interested in internal medicine, doing an internal medicine rotation, if you're interested in anesthesiology, trying to get that rotation, that would be ideal. But if that's not possible, that's okay. And when you're on these rotations, you want to make sure you do the best that you can, showing up early, being eager, being willing to read up on your patients and your topics, asking your attendings questions, but at an appropriate time, not in the middle of patient care, but when there's a break or over lunch. And around the third week, I would say you should approach your attending if you've been working with the same one. But if you've been working with different attendings throughout, see which one you clicked with the most or who knows you the best. And don't be afraid to ask for a letter of recommendation. And when you do, make sure you ask them for a strong letter of recommendation. It is very important to use those words because, they see a lot of students that rotate through. So one thing you want to remember is, how do you make yourself stand out to them? What can they write in their letter of recommendation to these program directors about you? Is it because you went that extra mile for your patient to get them like a blanket, or did you follow up on gathering more history from this patient that the team couldn't because they're rounding? Tiny things that you can do, because even as a resident, I know when my medical students come up with a great plan or read up on something that we haven't, thought about, or, provided an extra insight into the history, it's much appreciated. It does go a long way, even though you feel like you're not doing much.
No, those are great points. If I may interrupt, so two quick questions. One is when you say a strong letter of recommendation, can you provide a little bit more insight to our viewers? What do you mean by a strong letter of recommendation? Are we looking for the words adjectives or something like that? So can you provide a little bit more insight into it?
So, when asking like and attending for a strong letter of recommendation, they also understand like what you're asking for. A letter of recommendation is there's a lot of generalized letter of recommendations and all program directors look at it and it's going to sound the same. You're going to look like the next person. It's not different. So when you ask an attending and you say the word strong, they also know that you mean they want you to you want them to put more effort into this letter, and I would say definitely ask that from an attending you clicked with or one that you think understood you more, maybe not the one that you only saw like a few days out of the whole rotation but didn't work as closely with.
Absolutely. And then this could be a cultural issue as well. The people who are not born in America or the applicants who are not gone to medical school in America, sometimes they are shy enough in even asking that, can you write me a letter of recommendation, let alone saying that, give me a strong letter of recommendation. So any tips to overcome that shyness or this is
Right.
the
So that's very important because I felt like that is some of the advice I would always give to my friends from India as well. I was like, you guys just got to ask. And I'm still getting used to asking and, being assertive and asking for what you want. And I would say the more you do it, the easier it gets. So
absolutely.
you just got to start. And the thing is, medicine is the type of career that you're going to be told like no a lot of times. So you can't let that get you down. So, you're going to feel shy and anxious the first time you ask, but then the second time you do it on your rotation, it's going to be better.
It becomes
And
easy.
then the third, it's going to be even better to the point where you're not going to feel anxious anymore. So you got to do it. It's for your future.
Yes, absolutely. Your future depends on it. And one question from previous comment you make it. So do you have any magic number of rotations? How many rotations they should do or when they should do it, if you want to comment on
Okay, so I don't have a magic number of rotations. I ended up doing 3 rotations. And I worked, and honestly, for me, it's different. Like a lot of my friends, they did them all in the hospital. I couldn't do in the Pacific Northwest. They're actually very resistant to IMGs doing rotations in inpatient settings. So all of my rotations were in the outpatient setting. Of course, did that make me feel very nervous and scared that I don't have inpatient experience? Yes, but I still made the best of what I could do. So I did 3 rotations. One was an endocrinology rotation, one was internal medicine, and one was family medicine. So I don't think there's a magic number. I just think you get what you put in. So whatever rotation you have, whatever situation you're in, make the best of it. Show up every day, and put your hard work in.
that?
And then
Absolutely.
in regards to your other question of when you should do it, basically depends on when your schedule allows. For me, I finished up everything in India in regards to like my training and left like a few months of my internship, came home, did my 3 stretch of like gave my steps, did my rotations, and then went back to India and completed my internship. But I know a few of my colleagues also took time out during their internship, would come to US for a month and do a rotation and then go back and continue their rotations there. I think the answer to that is whenever you get it, like, because you're going to apply and they're going to have certain times that are available. So, you got to be a little bit flexible to be willing to go whenever they have the spot for you.
Valid point, very valid point. Let's say you have done your rotations and then you finish your medical school and came. So any insight for exams, if something worked better for you in one of the exams, step 1 and step 2, that this was the magic key. If I would not do that, I'll not be scoring that high or I'll not be scoring or passing the exam. So any quick tips about the exam?
Okay, so for step 1, there's a lot of just remote memorization, micropharma, know it by the back of your hands. Those are easy questions and easy points that you can get. And I think it also depends on your study style. So when I was studying for step one, I didn't really have sketchy micro and things. So if you're a visual person, those are also very great to help you memorize micro. For me, I work by writing out things, and that's how I remember it. I feel like India just taught me that's how I study. So that worked for me, writing things out. And then for biochemistry, I would make all the charts and put them on a wall, and see how each system like connected, each pathway connected to the other. So I had an overall picture, and I would look at that every morning for about 5 to 10 minutes before I started. And that kind of helped with that. The other thing that I really enjoy, because I learn more by teaching, and that's how I know that I know the material. So I actually had a friend that was studying for the steps at the same time. So we would get up, on Skype or FaceTime and just teach each other, like, this is what I learned today, or this is what what they did. The most important thing I would say when studying for them, for these steps, everyone has a different way of doing it, but the way I figured out worked for me, but it took trial and error, so hopefully you guys don't have to do this. I would say when you start your UWorld questions, right, do it system based. Don't do mixed, don't do that. That will happen. It'll all stick there, but start system based. For example, like do your micro, like, a block of 40, when you do it, do pharma, that's fine. But for me, like when you start like CVS, like cardiovascular, click physiology, pathophysiology, and even pharmacology for that, and make a group of 40 questions. Because what that does is there's some repetitive questions that attack the same topic, and
consolidate your knowledge about it.
And it consolidates your knowledge. Like when I did pulmonology, I got like 5 pulmonary embolism questions wrong until I got them right, because like it would just kept coming and coming. So when starting off, I know it seems daunting, but go system based. Respiratory, cardiovascular, GI. And once you've completed all of your UWorld at one point and you do your incorrects, then you can mix it up and do mixed blocks. But the other thing I would say is in the beginning when you're doing them, also don't make your blocks timed, because you don't need that extra pressure right now. So make them untimed, make them subject wise, and then it's up to you if you want to do all 40 and then review them, or do the option where you answer the one question and you get the answer right away. And I liked that in the beginning, because I was like, this is my thought process. Did I get it right, or did I get it wrong? And why did I get it wrong? And the other thing when reading these questions, make it a habit of reading the last question first and then going to the top, without even reading the options. Because when you read the last question, it gives you an idea. Are you looking for the mechanism of action, the side effect, the treatment? So you have that mindset.
You mean to say the last sentence of the question?
The last sentence of the question. And then read the stem, and you should read it slow enough but fast enough that you don't have to go back and read it again.
That's a very excellent point you're making, that sometimes you will think what they'll be asking, but most of the time they will give away that thing in question. So it's reading, as soon as you start the reading questions, read the last sentence. They'll give you an idea what they're asking, so your thought process can start. That's a very, very good point for you.
And the other thing I would say, as I learned when studying for step 2, after reading the last sentence of the question, going through, come up with your answer for that question. Because what will happen is when you look at those answer choices, if your answer that you came up is one of them, choose them, move on. Because what will happen in step 2 is you'll always come down to the last 2. And then it's 50-50 and you're like, which one is it? So try coming up with the answer yourself, and don't change like your mind. I know it's really hard. And the other thing that I learned from step 1 that I changed for step 2, when going through the questions and you're marking them, please only mark the ones that if you had a few more minutes to think about it, you would get correct. Do not mark the one that you did not read, that is out of the ballpark, that you are making a wild guess on. And you have a 25% chance, answer it, move on. Mark only the questions that, like I said, if you had a little bit more time, you would get right. Don't mark questions that you're like, there is no way I know the answer to this and I'm practically guessing. Guess, move on.
Don't waste your time. Yeah, so spend your time where you have chances of getting 50% right out of last two ones as well. So that's a great point as well.
So, because like for step 1, there are blocks of 40 questions and like 20 of them would be marked. And by the end, I'd have anxiety every block. And I realized that wasn't helpful for me moving in. So for step 2, I had about 5 questions marked, even though, and those were not even the 5 that I knew I was getting wrong, because there's some that you're going to. And lastly, about biostats, leave the biostatistic questions for last, especially when they come in with the ad, because they do take a lot of time. So if you do them when they come through, you end up wasting more time, whereas at the end you're super focused because you have a limited amount of time. And that's what I would do. Those were the things that I kind of tweaked for step 2.
Yeah, and you can practice those things during your questions here and practice session as well, because you can see how many questions you're marking and how many of you end up doing right. So it'll give you an idea that once you review these questions, what's your success rate? Is it 10%, 25%, 50%, 75%? So most often you end up doing right, then please go ahead and change your answer. If you know that in your practice sessions, you have never got anything right, or it's 50-50, then why waste your time and spend time on some calculation questions like biostats, and also you can at least get a chance. So I think those could be practiced. Okay, so let's say if all done, you're done exams, interview season. You are an excellent public speaker. Knowing you giving the presentations, your podcast, and then through this interview. So what interview skills you worked upon, or you honed in before you went for your interview season, or something which you had a strong incline anyways? What can you tell us, our viewers?
So, like you said, for me, being a U.S. citizen, the interview process was probably the least, it was stressful, but the least stressful compared to what I knew my colleagues from India were experiencing. They were dreading the interview process. They were okay with everything else. They were dreading this process. And the way that the way I seem like I'm a great public speaker is because of preparation. So I would say it is not easy. The way I did it is I did prepare. I did Google up questions, like what are questions that people would ask during residency interviews. And there's a lot of forms out there. There's a lot of questions. So I made a giant list, and what I did was I would practice my answer. And the thing is, when I would answer it, I would write down bullet points, not sentences and not like a full script, because when you're at these interviews, you don't want to sound scripted. They can tell when they're going to ask you a question like, oh, well, what's one really bad quality about you? You're going to get that question. You're going to get the question where they're going to ask you, what do you think is not the greatest part about you? And that's really hard to talk about. And if you already have that scripted, they're going to know. These interviewers know when you're talking scripted. So I would never write everything word for word and try to memorize that bullet point. I want to touch on this and this and this, because it'll change every time. So I would say prepare your answers. And what I also did was I literally took a mirror and would sit in front of it and talk and see what my facial expressions and how I did, just because when you're practicing and reading off of a note card, it's easier to look down, but your facial expressions and how you uphold yourself during an interview is important. A few questions that, and I think I prepared for them well. I think a few of the questions that I guess I wasn't completely prepared for was one kind, and it's funny because as I'm trying to think about fellowship, it's kind of the same things fellows have told me. And it's, yes, you're applying for residency, but what's your end goal? What's your future? And you're like, wait, I just wanted to get into residency. I didn't think about the future. But a lot of people ask you about the future. So kind of have an idea of what you want to do. Because I did make up that answer a few times on the spot. So the other question, and it's kind of in regards to the future, and it was actually a question that after interviews, one of my colleagues asked me, and he said he had a really hard time answering that. And I told him how I would have answered it. And he's like, oh, I wish you told me this before I went in. And, he's born and raised in India, and he's interviewing here. And I guess one of the interviewers asked him, so, you're here, you're going to do residency. Do you plan on staying, or do you plan on going back? And that's a big question that a lot of people will get, answered. And I even got that question of you went to medical school in India, you're from here, what's your future plan? What do you plan on doing? So, there's two ways to think about it. Are you just coming to get your training and then we're going to lose a great physician that we trained back to India? Or, or are you just coming here to train here and you don't care about India? You gotta balance it. So, and this is something I actually truly want to do, especially with like everything that I experienced and saw in India, is being able to, once I get on my feet and become like, where established, to be able to go back and, start a nonprofit organization and help my community there. And I had explained that that's how I would have answered that question. As well, saying that I definitely want to learn all the skills I can here, but I would eventually take it back and help however I could. And things like that, you have to be able to finesse your way around something.
There's no right answer as
There is
far as you are truthful and genuine about it, and then they're not looking for, this is not a trap question. They're
no.
looking at how well you can handle it, and then whatever you generally want to do, it will be there as well. This is great. So uh, share one fun part during your interview trail, during observership, or during medical school. Something strange happened to you and was like you cannot forget it, just for the humorous part of it. I know I'm putting you on the spot, but
Right. Ooh.
something during your interview trail or your
It
observership.
was, so I would say, okay, it was actually during my interview trail, because I've thought about this a few times. The more interviews you go on, the more comfortable you get. And I would say, like, be yourself. So there was one time, I was interviewing in Atlanta, and the PD had asked me, so like, he's like, well, what about Atlanta? And he's like, well, where else are you thinking about? Like, where else have you interviewed? Like, what about Florida? And I was like, yes, I'm interviewing there as well. My brother, he went to SGU and we've been super close. So I'm like, I want to be close where I can visit him. So he's like, why? Like, he's like, so why wouldn't you want to go to Florida? And without like thinking, my response was like, do you know what the humidity would do to my hair? And he laughed and I laughed, and I was like, I didn't even think I would say that, but it was just something that it just came out of the moment. But you get more relaxed. It was unexpected, and I was even surprised at my answer, that I was like, oh, did I just tell the program director that Florida would mess up my hair?
So that's an important point, actually. This is not only funny, but see how relaxed you were. And then most of the time, IMGs from India, Pakistan, Jordan, anywhere they are, we think it's very serious business. You don't laugh, you don't crack jokes around, very serious, sitting down. It's okay. This is human beings. Like having this humorous side of you gives them a glimpse that you are okay. You're a normal human being.
Right.
You're
Which is, and it was funny because this was my last interview. So I was interviewed out, and I was still, like you said, I was shocked. I'm like, oh my gosh, I can't believe I just said that to the PD of this program. Like, but we were laughing. So I'm like, oh, it's okay. Like, it's okay to laugh and be normal.
It's okay. Exactly.
Yeah.
Okay, one thing you mentioned about that you might have a list of questions. So we are hoping that we can have you back and probably go through some of these questions and answers within a week or so for our viewers in a separate video. So can you summarize 3 points from this discussion today? What you want an IMG from India, Pakistan, Jordan, anywhere in the world when they're coming and applying for residency during observership, interview skills, or rank list time? What 3 major points you want to share with them?
So I would say definitely apply broad and be aggressive about getting rotations, and not being afraid to ask for that strong letter of recommendation. The earlier you start doing it, the easier it's going to get. Number 2, practice your interviews questions. I don't care what anyone says, practice is why it looks like it makes it easy, but you want to be able to practice that in front of a mirror. And then thirdly, I want to say that, be yourself. I know it's really hard. It's a stressful time, but also enjoy the process. It's stressful, but have fun while doing it. You'll enjoy it.
That is excellent. I'm just going to share your Dr. Navneet Kaur's contact details here. Please do follow her on Twitter at NaviKaurMD. Her Instagram accounts, I think Therefore I Am, very interesting interview. She has it there as well. And then Fueled by Medicine. So please do follow and then let us know in comment section what you liked, what other things you want to hear from Dr. Kaur, and other international medical graduates. Do follow us, do subscribe as well, and we will look forward for you to have join and subscribe to our channel, and many more interviews we're going to bring it to you. Thank you so much for watching. Thanks much.